Hey Don, you got a minute?
Yeah, sure. What's going on?
We'll make it quick. We need to finish up the SNOCAP holiday greeting video. Are you ready for that?
Oh, yeah, we got to get that done. Are the other PBRNs, our PIs, PRAs, and DFM groups like PIPCO, are they all ready with their stuff?
They are. They've all received their emails, but Don, that's far too many acronyms. Put a dollar in the jargon jar.
Well, here we are, the end of 2020. What a memorable year this has been.
We've all put in a lot of hard work, probably the craziest hours, schedules, and work settings of our lives.
We've all experienced a lot of hardships this year, many changes personally and professionally.
Even with all of those changes, we've been able to find new ways to connect with our communities, patients, and partners.
We have heard of practices making patient rooms in tents and parking lots, mobile vans to see patients and deliver supplies.
Drive-through patient visits and more plastic sheeting than we ever thought the hardware store kept in stock.
We've heard from patients and communities how they have appreciated changes in clinic flow to keep their safety in mind.
The ways that they have been able to connect with their doctors from the security of their homes.
And the support they have received from a combination of so many different services.
Thank you for your perseverance and creativity in patient care and engagement during this difficult time.
Thank you for finding creative ways to continue seeing your patients.
Thank you for your resilience and your commitment to your community's health.
Thank you for your perseverance.
Thank you for all you do for your communities. And thank you so much for all you do working with us to support and advance primary care.
As we go into this next season and a new year, we are sure to still experience a lot of uncertainty.
These are still strange times, but we will continue to be present and connected.
We know you'll continue to amaze us with your creativity, resilience, and resourcefulness.
As always, we know that you will continue to do whatever you need to care for your communities, your patients,
and your loved ones. We are wishing you well this winter season and look forward to a healthy and joyous new year.
Thank you.
In the Colorado Children's Outcomes Network, or COCONET, we've been focused on promoting recommended vaccines for pregnant patients, infants, and adolescents. We're now working with 12 pediatric practices and 5 prenatal care clinics, testing physician communication approaches to address vaccine hesitancy for the maternal and infant vaccination series. Thank you to our Pivot and MI for MI participating practices. Additionally, we have 3 ongoing studies promoting adolescent vaccines. These studies are working across the state of Colorado and are engaging practices, patients, families, and community members to develop innovative and creative messaging for teens and their families, like these. We hope many of you will see these messages in your communities in the coming months. Thank you to our partners in our RADVAX, HPV Bootcamp, and Larimer County studies. We're so grateful for your partnership and commitment to improving adolescent vaccination. Thank you to everyone who's participated in these important vaccine studies. We look forward to continuing to address vaccine hesitancy and promoting these and other important vaccines alongside you in 2021. Happy holidays and a happy new year.
Hi everyone, check out these results from the It Matters study. 441 clinicians and practice staff from 42 practices in the High Plains Research Network and CareNet practices in the San Luis Valley received training in medication-assisted treatment for opioid use disorder. And not only did you learn something, but you took action. We saw significant increases in the number of practices engaging in providing this treatment to their patients, and significant increases in the number of patients with a prescription for buprenorphine in the study region. So thanks to all of you who took these steps forward to provide this treatment to your patients in need, to help them get their lives back, and to help the health of rural Colorado. If your practice would like the training, give us a call. Thanks so much.
Thank you to those practices that have spent time filling out our SNOCAP COVID-19 response surveys these past 9 months. We began surveying practices on March 17th and have since shared 9 data reports. With your help, one survey reached 152 respondents. Thank you.
We are always learning more about the resiliency and resourcefulness of practices. By the end of March, nearly all responding practices were offering virtual or telehealth visits. What a speedy response.
We know that practices statewide have experienced periods of severe financial crisis, which has brought a lot of discomfort in hard times. And still now practices experience uncertainty and complications around billing for telehealth visits and reimbursement. Through shifting to telehealth and virtual visits, securing small loans, and working through staffing changes, we have heard that practices were able to survive and continue to thrive to this day.
SNOCAP has partnered with Family Medicine United for Colorado, who is offering free consultation and responses to burning questions through their answer bank. Thank you again for your resilience, partnership, and response.
Cascade is a community-based study in primary care and pediatric practices that aims to test ways to prevent atopic dermatitis or eczema in infants. Parents and their infants receive either an emollient to use on their child or routine skincare instructions and are asked to complete brief surveys over the course of 2 years. We are in the 3rd year of this study and work with 5 practices in Colorado. Currently, practices are wrapping up referrals to the study, and we are engaging in chart audits to assess skin and related health conditions at 12 and 24 months. This study has helped start a discussion within participating communities about infant skincare and eczema prevention. We are grateful to the participating practices for their commitment to this project and their patients. Thank you and happy holidays.
Thank you so much to everyone who's participated in the Meadowlark Advanced Care Planning project. Even though we finished patient referrals to the study, we're looking ahead to sustaining serious illness conversations in practice sites. Thank you so much for your hard work during this past year, and we look forward to continuing to work with you in 2021.
The High Plains Research Network is working with the University of Cornell to study whether a promising screening questionnaire called the CAPTURE tool can help detect COPD earlier in primary care patients with unrecognized COPD symptoms. Earlier detection means earlier treatment and better health, and HPRN is playing a key role in ensuring that rural primary care practices and patients are included in this research. So far, over 430 patients from Eastern Colorado have participated in the CAPTURE study. About a third of all of the participants across the country are from rural regions, largely because of your participation. As one practice manager said, our patients loved being a part of the CAPTURE study with others around the country, right here in our own town. They've lost friends and family with COPD and they want to help. So we want to say a big thank you to the 9 HPRN practices who have participated so far. We look forward to working with more of you in 2021, and we will be sharing what we're learning as soon as results are available.
Thank you, primary care practices, for all that you do for the people of Colorado. Today, I'm speaking on behalf of the Practice Innovation Program, and we want to express our appreciation for the opportunity to work with such caring teams whom we've met through many of our programs. In those programs, we saw your commitment to excellence, but in the pandemic, we see your resilience and your creative problem solving as you address new challenges, including the significant rise in unhealthy alcohol use among Coloradans. We'd like to encourage you to join our FAST program to enhance the skills of you and your team to address this growing problem. In the meantime, we'd like to wish you happy holidays and an even happier new year.